Catawba Medical Foundation focuses on advancing our health system's ability to care for our community for generations to come. We know a strong healthcare system anchors and strengthens the community it serves. So we are constantly working to provide the additional funds needed to stay independent. We know that local leadership ensures our ability to do the right thing for Catawba Valley. The foundation raised just under $1 million this year and gave back $850,000 to the hospital through our regular Women in Philanthropy and Catawba Cares Employee Giving Council grants. Accomplishments in 2017 include our new mammography truck with 3D technology, our fitness track refurbishments, audio-visual improvements for AHEC 112, which serves as a conference room to train employees, have staff meetings, as well as a community room where we have outside organizations coming in to either hear presentations on behalf of the hospital or to hold meetings for their causes. Sound reducing curtains for our post-anesthesia care unit. Our Good Samaritan's Closet, which provides patients who have no other means walkers and wheelchairs and clothing and sometimes oxygen to take home with them when they're discharged from the hospital. And probably our most interesting and lasting project from 2017 was the creation of our Wall of History in celebration of our hospital's 50th anniversary.
I am Michael Green. I am the administrator of diagnostic services, so all of imaging, lithotripsy, and neurodiagnostics and sleep center. A tractor trailer was donated by Cargo Transporters for our lithotripsy service. The other tractors that we had were 1980 was one of them and 1984 was the other. And one of them actually had over 3 million miles on it. Our old tractor trailers were serviced by Cargo Transporters, and they knew that the condition of them, that we were starting to have more mechanical needs. And through that, John called Eddie Beard and asked if we would be interested in him making a donation to the foundation. And kind of from that, that's kind of what led it off into us getting this donation from Cargo Transporter. I just want to thank Cargo Transporters for being so easy to work with. They were able to show us what they had available out on their lot, and that was very useful to the driver to be able to test it out before we bought it, or before it was donated, sorry. But other than that, just the ease of being able to work with them.
Hello, I'm Sonia Fleming. I'm the Director of Patient Experience. You may be asking, what is patient experience? Patient experience is the patient's perspective of all their interactions during their care. So it's not just the clinical interactions, it's everything that they see, they touch, they feel, they think. And at Catawba, we've really made a commitment to improving that experience for the patient and for their family. And we're very thankful to the foundation because with the help of the foundation, we have been able to add a relaxation channel for patients and their families. The care channel is broadcasted into the patient's room on channel 70 through the TV. It consists of beautiful images of nature and instrumental music that's composed specifically to create a healing environment. There's over 80 hours of original content, so the patient is not seeing that same waterfall over and over and over. At the end of the 80 hours, it does start over, but it shuffles the content. Each night around 10 o'clock, the sun sets and it switches to a star field, and the music gets even more relaxing, which assists with sleep, and it also helps the patient be able to distinguish between day and night. Then the next morning, around 6 a.m., the sun rises and it switches back to daytime programming. We have seen the difference that the Care Channel has made, especially for patients that are confused, agitated, and scared. It also provides a focal point for those that are in pain, and it can mask some of the sounds of a hospital. For those patients that fall in love with the Care Channel, they can take it home with them because we've also added the streaming version on our patient portal. I want to personally thank you for supporting the foundation. Not only am I the Director of Patient Experience, but I've been a family member of a patient and spent 40-some nights in a hospital. So I know all the different ways this relaxation channel can support a family, as well as our caregivers, by providing an additional tool that they have to offer folks. Thank you.
My name is Lauren Shoemaker. I'm the clinical care manager here on the birthing center, and we started a fall committee to see how we could reduce our maternal falls and decrease employee injury. And we found a wonderful piece of equipment called the Sarah Steady that we use to get our patients up for the first time after they deliver, if they've had a lot of blood loss during their delivery, or if they've been on any kind of medications that would cause them to be dizzy or increase their fall risk. We use the Sarah Steady on every patient, or at least have it in the room if we need it, after getting the patients up after they deliver, post-epidural or post-C-section, where their legs may be numb still, or they're just having some trouble getting out of bed due to their incision. The nurse wheels the Sarah Steady to the patient, assists them to stand up, and then we wheel them to the bathroom. It decreases the amount of staff that we need in taking patients to the bathroom, and also makes the patient feel safer. Thank you, Women in Philanthropy.
I think the employees had a wonderful time with the 50th anniversary celebration.
A lot of folks have been here 25 years, and I think they appreciated the time and the effort and the opportunity to celebrate with the hospital, with their peers.
I heard everybody went all out for it, and they felt really special, like the hospital really cared about them as employees and for what we do here, so it was really good. I absolutely love the history wall. It's very interesting for me to be able to read different things as I pass the hall. There are a lot of things that I didn't know about the hospital here until I got to see the history wall. I've been here since 2004, so I've missed quite some time, and so it got me a little bit caught up. That was really great to see.
I just celebrated my 24th year here, and so I've walked these halls many, many times, and it's nice to see, and I look at, every time I walk down the hall, I see something new. It's just nice to see the progress. It's nice to see the accomplishments. Many I was here for, because I've been here for a while, but there were things I didn't know, even being here as long as I've been here. So it's nice to walk down the hall and to work in an organization that you feel so accomplished to work with.
A wonderful big thank you to all of the donors that keep us going and appreciate us as much as we appreciate you. Thank you.
Thank you for all you do. Every day what you do makes a difference. You may not directly touch patients, but you indirectly touch patients with what you do every single day. I'm at the bedside, I see it, I feel it. I think our community feels it, and we appreciate what you do.
On behalf of Catawba Valley Medical Center, I want to thank our generous donors. I'm excited to introduce our new name, Catawba Valley Health System, which better reflects the way we play in the community as not only a provider for the sick, but a resource to keep our community well. Catawba Valley Health System is composed of the Medical Center, the Primary Care and Specialty Medical Groups, and Catawba Medical Foundation. Over the course of 50 years, we have grown from a small rural hospital into a not-for-profit health system. Catawba Valley Health System, built around the services of the Medical Center, includes Catawba Valley Medical Group as well as the Catawba Medical Foundation. The medical group is comprised of 15 primary care practices, an urgent care center, 3 employee on-site clinics, and 3 specialty practices. Catawba Medical Foundation plays a key role in helping our system stay competitive in today's challenging health environment. Together, the hospital, medical group, and foundation work together to ensure we meet our mission of exceptional health care, every person, every time. I'm so proud of the work the Employee Giving Council has done to educate our workforce about the foundation. It says so much about a place when our workforce invests in itself by supporting the foundation. Going forward, we know that much in healthcare is uncertain. We are looking to the foundation to continue to fill the gaps by helping us fund large and small projects. Our community is amazing in its generosity. We are the hospital the community built, and we are grateful for your support. You are the reason we are here and will be in the future. It is an honor to serve you.